Hello! This screencast will explain what the Local Collaborative Time Study is, commonly referred to as LCTS. You may also have heard it as the Random Moments in Time Study. This screencast was recorded in November of 2015. So what is the Local Collaborative Time Study? It is Minnesota's federally approved claiming mechanism for Medicaid, which is MA, and Title 4-E, Administrative Reimbursement for Minnesota's Family Service and Children's Mental Health Collaboratives. The three types of public entities that participate in this project are eligible public school districts, county public health agencies, and correction agencies. This screencast is designed for LCTS participants for eligible public school districts. Reimbursement is earned by staff for eligible activities they perform to assist the state in administration of the MA and Title 4-E state plans. There are currently 89 children's mental health and family services collaboratives in Minnesota, 12 of which are children's mental health collaboratives, 47 are family services collaboratives, and 30 of which are integrated. Collaboratives were envisioned and created as an approach to address the needs of children faced with complex problems, maximize results and resources by enhancing coordination and reducing duplication among systems, and to involve communities, particularly families, in system redesign and implementation so their needs are effectively met. Collaboratives strive to improve outreach and early identification, coordinate assessments and services across agencies, and to integrate funding and resources. Through a comprehensive planning process, each family services collaborative must design and implement an integrated local service delivery system for children and their families that coordinates services across agencies and is client-centered. The delivery system shall provide a continuum of services for children birth to age 18 or birth through age 21 for individuals with disabilities. The following chart shows how the funding stream works. The funds come from the federal government, and then the first 5% goes to the state of Minnesota, up to 5% goes to Hennepin County, 5% goes to Children's Mental Health Collaborative, and then the remaining 85% is spent on the following categories: child and or family health, child development and school performance, family functioning, organization, community, and systems change, and other early interventions and prevention services. Each collaborative chooses how to spend their money in these categories, which differs across collaboratives. So who participates in this study? If you are employed at least 20 hours and spend at least 40% of your time working to provide case management, service coordination, or outreach on behalf of children experiencing risk factors, special needs, or health concerns, then you are eligible to participate in the LCTS. If you are uncertain whether you qualify, you can contact your LCTS coordinator. Case management, service coordination, and outreach related to children's welfare, risk of placement, or health generally includes helping children and their families access appropriate services and resources, developing and reviewing intervention or care plans, assessing or identifying the needs of children, following up and evaluating the effectiveness of services, and providing information through outreach activities such as training, public speaking, and community planning meetings. So how does the study work? As a participant, you will receive an email that looks like this. It will have your name, the date and time of the random moment, and when it will expire. If you do not complete it the first time, you will receive a reminder email. You will click on the link to go to the web-based application. This is what it will look like. If you are not the intended recipient, you can click on the Not You up on the upper right-hand corner. If you are the intended recipient, then you can select one of the codes that best represents the activity performed at that specific date and time. You will then add a brief description of what you were doing and who you were with. Then you can click Submit. If it requires a validator, it will ask you to put in the validator and the email. Then you can click Submit. Once you click Submit, you cannot change the code, so please be sure to double check the code prior to submitting. To find more information about LCTS, you can go to the Department of Human Services website that looks like this. You can go to mn.gov/DHS. Then hover over the green General Public tab and hover over Publications, Forms, and Resources, and then select Bulletins. Once you are on that page, select 2015 Bulletins and scroll down to General Fiscal Reporting and Accounting, and then click on number 15-32-10, which is the Local Collaborative Time Study Operations and Activity Codes. You will want to familiarize yourself with attachments D, E, J, L, M, and N. Attachments L, M, and N refer to the activity codes. The Activity Reference Guide is attachment N, which explains what all the codes mean. Once you know what codes you will be using most commonly, you can utilize the flowchart, which is attachment L, and then the snapshot of codes, which is attachment M. If you prefer to have a direct link to the bulletin, this is the link, or you can follow the directions stated prior. I hope you enjoyed the screencast, and have a great day.